We're very lucky that we've actually been joined by a diabetologist today, and he will let us know whether what we need to do to make sure to, number one, avoid diabetes, number two, God forbid, if you have type 1 or type 2, what do we need to do, and then number three, certainly if he wants to give out a message, I would want everybody to sit down with a paper and pen. Ladies and gentlemen, we're very lucky that we've been joined by Dr. Shahid Nadeem, who happens to be a diabetologist. Hello sir, assalamu alaikum, good morning, how are you?
Wa alaikum assalam, thank you for inviting me.
Thank you so much, sir, for joining us. Wonderful to have you. Just let me know, first things first, do you take sugar in your coffee or tea?
No.
Sometimes.
Yeah,
I think that's fine.
But
That's fine.
I think in the rich tapestry of the South Asia, there is a silent killer which is on the rise, which is called diabetes, sir. And Pakistan, it ranks on the top chart, right? So, sir, why do you think we are so susceptible to this silent killer?
You see, diabetes is growing rapidly in Pakistan, and according to International Diabetes Federation, 27% people are diabetic in Pakistan, but in my experience, the figure is much more worse than this. Okay. And the reasons behind this is the number one top reason behind this diabetes is obesity. And inside obesity, there is a term known as central obesity. People in Pakistan, especially men, have their waist circumstance of about more than 37 centimeters, and women, most women having their waist circumstance of 32 centimeters, and this is the main factor. The obesity and central obesity, the main reason why people.
But sir, why is it the main reason? Now imagine for a guy who's 6'3", you know, if he's got a waist of 36 inches, you know, why are we going to refer to him as somebody who's obese? Are we going to refer to him as somebody who's somewhere in the middle? What impact do you think or what role will BMI play? You know, I think these are the things that we really need to keep in consideration, no?
Yes, definitely. But you see, when in Pakistan, everybody thinks, people talk to me that I'm smart, I don't have fat on my shoulders, but only my tummy is going out. Yeah. And but when people don't realize this type of obesity, central obesity, then this is the main risk factor behind diabetes, hypertension, so many metabolic diseases.
So, Dr. Saab, now please tell us, why are we suffering from it? You talked about the obesity. Why do you think Pakistan is such an obese nation? Because there's so much poverty, stark poverty, and especially at the fringes, at the periphery, but yet we are still ravaged by this.
You see, in Pakistan, people are coming towards a sedentary lifestyle. Okay. They stop moving outside. They stop going for any physical activity, joining gym, doing walk, but they like to work on mobile, laptops, and
gadgets.
Not even work, spend time on mobile and laptops.
Yes.
That's it.
Yes. Even children, they are spending so much time on sitting on mobiles and playing games, while our grounds are vacant.
Exactly, and I think that this culture really needs to come back, because imagine that when we were going to school, first of all, we had bigger grounds, bigger schools as well. There were sports, periods and whatnot. I think we need to bring back that culture. But if we are to kind of talk about somebody who's suffering from diabetes already, how long does it take to treat diabetes, number one? Number two, we see these videos on social media that diabetes is reversible. So please address both of these questions if it is possible.
You see, diabetes is a hormonal problem. It's a chronic disease. It's not like a flu or any infection which can be cured in weeks or 2 weeks time. It any kind of diabetes, type 1, type 2, gestation, any kind of diabetes, it takes the combination of three things. There are three things which in combination can treat diabetes, any kind of diabetes. Good lifestyle, physically active lifestyle, diet, good balanced diet, and number three is the right dose of right medication. So these are three things. But you see, and it usually, any kind of diet, it usually takes a few weeks time to treat any kind of, to control any kind of diabetes. But there is no 100% cure.
Okay.
We can control diabetes, but
So with type 1 and type 2, does it vary?
yes, definitely, because type 1 is that kind of diabetes in which your pancreas is not producing insulin.
Okay.
See, so we need to give
So we have to inject
insulin
insulin.
to type 1 diabetes.
That's different.
While type 2 diabetes, the pathology is different. In type 2 diabetes, sometimes insulin is secreted in much more quantity.
All right.
But it's not, acting properly because of insulin resistance. Sometimes insulin is secreting, but the demand supply is there. It's not fulfilling the demand of the
right.
body.
And Dr. Saab, on the closing note, I would like to ask you, how do you define a good diet? Because I do feel that roti, which is a staple of South Asia, is something which is also contributing to this menace, if I'm not wrong,
And all Sahaba, all prophets used to eat the jho ki roti, if everybody out there, if you've actually read about the books and the Sunnah as well, you'll get to know about this as well. And, towards the end, if you have any message for our audiences, please go ahead.
Yes. You see, I'm practicing diabetes for the last 25 years.
But you only look 25. You only look 25 years old, alhamdulillah.
Thanks. But in 25 years, there's one message for diabetic patients. You see, any kind of diabetes, type 1, type 2, any kind of uncontrolled diabetes can be managed properly with a combination of three things. There's a formula.
Yeah.
There's a formula in which there are three things. Good balanced diet, including roti, but whole grain. You can, but in certain amount, in certain quantity, but
not too much.
Not too much, and when you are in hypos, when you are controlling diabetes, then you can. But in uncontrolled diabetes, you cannot. If this good diet, balanced diet, including roti, meat, protein, fats, good fats, and active lifestyle. You should be, in ground for half an hour or 45 minutes for doing walk regularly on daily basis, at least 6 days a week. And good medication. You remain in contact with your doctor, your diabetologist regularly.
Right.
Exactly.
And thank you so much, Dr. Saab, for coming here, for shedding the light on the diabetes and how we can manage to live with the diabetes, because it is a pandemic that is very, very common in South Asia, particularly in Pakistan.